Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Neuropathies which are associated with the prominent autonomic dysfunction. So under this there is a hereditary sensory. So there is hereditary sensory. So hereditary sensory and also the autonomic neuropathy. Autonomic neuropathy. Next is there is presence of amyloidosis. Amyloidosis. So there's presence of amyloidosis. Amyloidosis can be familial as well as the acquired. Then comes the presence of the diabetes mellitus. So it is DM. Then is the idiopathic. There is idiopathic pandiautonomia. Pandiautonomia. Autonomia. So this may be a variant of the Guillain-Barré syndrome. This may be a variant. This may be a variant of the Guillain-Barré syndrome. Guillain-Barré syndrome. Next is the presence of the porphyria. Then is the HIV. Then comes the HIV related autonomic neuropathy. Autonomic neuropathy. Next, what are the other drugs? Other drugs, it includes the vincristine. So vincristine is involved, as well as the chemotherapeutic agents. Chemotherapeutic agents are involved. To learn and grow daily like this, please do subscribe.